To an outsider, this scene would look like a normal day in a household, but the naked eye is blind to one thing: the powder-looking substance in one of the envelopes. And with one breath, the whole family is in jeopardy. What could turn that seemingly normal day into a nightmare? Join me as we explore all there is to know about one disease that gained headlines in 2001, anthrax. Wool sorter's disease or ragpicker's disease may not sound familiar to you, but Bacillus anthracis, more commonly known as anthrax, might ring some bells. The name derives from the Greek word for coal because when it attacks a person's skin, a sore appears with a coal-black center. To talk more about this is a scientist we are meeting, so we're headed to the Centers for Disease Control and Prevention HQ to talk to scientist Dr. Anthrax about the cause of anthrax. Hi, Dr. Rax. Nice to meet you. Hello, everyone. Welcome to the CDC headquarters. Let's get right into it. What is the cause of anthrax? There are three commonly known types of anthrax: inhalation anthrax, ingestion anthrax, and cutaneous anthrax. The fourth, and less commonly known, is injection anthrax. Let's start with cutaneous anthrax. What can someone expect? The pathogen enters the body through cut or broken skin and a pustule will form. The accumulation of the toxin produced by the disease will cause tissue death, and it will form what looks like a blackened lesion. What about gastrointestinal or ingestion anthrax? Well, gastrointestinal anthrax is the rarest form of anthrax infections. It is caused by ingestion of anthrax spores. From there, the bacteria will grow on the wall of the intestine, releasing toxins that will cause bleeding and tissue death. This type of anthrax can be easily fatal should the infection reach the bloodstream. How so? The toxins in the bacteria will break down the blood vessels, causing internal bleeding until death. Okay, I see. Let's discuss inhalation anthrax. If inhaled, the spores that originate in the lungs will multiply and spread to the lymph nodes near the lungs, causing them to break down and bleed before spreading the infection to the chest. This type of anthrax is considered the most fatal since it's so easily spread throughout the body. You have mentioned a toxin plays an important role in this disease. What did you mean by that? Yes, so anthrax contains three exotoxin components: a protective antigen, a lethal factor, and an edema factor, all of which are individually non-toxic. However, when the lethal factor and edema factor combine during germination, a powerful toxin is created. Then the spores create a polypeptide capsule that protects them when they are ingested by white blood cells. So the spores are ingested by the neighboring white blood cells and are used as Trojan horses to get close to the lymph nodes, therefore spreading the infection. Thank you so much for your time. Of course, good luck on the rest of your journey. Next, we head to the Mayo Clinic headquarters to talk to Dr. Jane Doe about the symptoms of anthrax. Hi, Dr. Doe. I recently learned that there are different types of anthrax, and I think it would be best if we went through the symptoms in relation to each type. So what can you tell me about cutaneous anthrax? Cutaneous anthrax has the most distinct symptoms on the skin. They form a raised, itchy bump, like an insect bite. Within 2 days, a painless sore with a black center will develop. As the infection develops, flu-like symptoms may appear, and with rare cases, the infection may even spread through the blood, causing blood poisoning, internal bleeding, or anthrax meningitis. So basically, the infection would have gone to the brain. What about the symptoms for inhalation anthrax? Inhalation anthrax is the second most common type, known for its part in bioterrorism techniques used in 2001. The first symptoms present themselves in a few hours to a few days. They're flu-like symptoms, however, shortness of breath, painful swallowing, and coughing up blood also appear. Because these symptoms can be from a variety of illnesses, it's hard to diagnose with a type of anthrax. Then within a day to 2 weeks, the symptoms will escalate to serious breathing problems and bronchitis. The symptoms that follow are more extreme, ranging from shock to meningitis to meningoencephalitis, which is an infection in the brain and its meninges. Wow, and what about gastrointestinal anthrax? The symptoms start out as flu-like symptoms, accompanied with stomach and intestinal inflammation, and might include some swelling of the neck glands. Other stomach-related symptoms include pain in the stomach and abdomen, vomiting, and loss of appetite. Without intervention, these symptoms will progress into more painful ones, such as bloody vomiting, bloody diarrhea, and a headache that causes the patient's face to turn red. I see. And now I heard there was a fourth type of anthrax, a man-made one. What about these symptoms for injection anthrax? So the newest and man-made form of contracting anthrax is through injection, usually during drug use. Symptoms start with redness in the area of the injection, followed by small blisters and swollen tissue around the area. At this time, flu-like symptoms may present themselves as well. The injection area will then progress to a painless sore with a black center that may include abscesses deep under the skin or in the muscle. Injection anthrax can spread faster through the body than other types and may progress to shock, multiple organ failure, and meningitis. Thank you, Dr. Doe. We've talked about the different types of anthrax, their causes and their symptoms. But is there a way to prevent contracting anthrax? We'll now talk to General Zablakis about the prevention of anthrax. Hello, General Zablakis. Thank you for having us. I heard there was an anthrax vaccine. Can you tell us more about that? Of course. The vaccine for anthrax is anthrax vaccine adsorbed, or AVA. It's more commonly known as Biothrax, and it's given to at-risk individuals. The vaccine was licensed in 1970 and requires 6 injections over 18 months, with 3 subcutaneous injections 3 weeks apart, and 3 more at 6 months, 12 months, and 18 months, with an annual booster. The vaccine is 93% effective. And who qualifies as an at-risk individual? At-risk workers include certain military personnel, research workers exposed to anthrax, veterinarians, and some livestock handlers. What about animals that could be infected? There's a vaccine for livestock widely available in the U.S. to prevent an outbreak of animal anthrax. The vaccine is called anthrax spore vaccine. What other preventative measures can one take to ensure not getting infected? The correct disposal of anthrax-infected animal carcasses is important, including deep burial, heat treatment, and incineration. Disinfecting and disposing contaminated material, such as the incineration or burial of dung, chemical sterilization of tools, and washing hands can mean the difference between an outbreak and a single case. Since anthrax can be easily transmitted to humans, travelers going to countries where the anthrax vaccine is not readily available should avoid contact with livestock and undercooked meat that could be infected. Those working with anthrax should also wear well-fitting masks with grain filters. Thank you. Preventions don't end for workers. After the anthrax scare and outbreak in 2001, it is recommended to inspect mail from unknown senders for powder, uneven weight, or excess tape. Make sure to be vigilant when opening mail with personal or confidential endorsements. In fact, some mailing distribution centers also use bacteria-killing radiation machines to sterilize their mail. We're here with treatment specialist Dr. S. Dr. S, what can you tell us about treatments for anthrax? Contrary to other types of vaccines, Biothrax can be taken after exposure to help fight the infection. Along with the vaccine, people such as nurses and researchers that get exposed to anthrax can take post-exposure prophylaxis drugs such as doxycycline or parenteroprocaine penicillin. What else can you tell me about the treatment and therapies? Penicillin is the most frequently used antibiotic to combat cutaneous anthrax infections, and it renders lesions sterile after 24 hours. However, tissue necrosis will continue to occur due to the presence of the bacterial toxin. This treatment should continue for 14 days. So, in anthrax cases where the patient is taking antibiotics to kill the bacteria, an antitoxin treatment therapy is most likely paired with it to target the anthrax toxins in the body. What if the patient is allergic to penicillin? If the patient is allergic to penicillin, they can take an oral dose of antibiotics such as tetracycline or erythromycin. We discussed treatment options for cutaneous anthrax, but what about other types of anthrax? Cases of inhalation anthrax and gastrointestinal anthrax are more severe and require attention before symptoms are even present. These cases need intensive care with intravenous medicine and fluids due to the rapid spread of infection. For the best rate of survival, treatment for these types of anthrax need to begin within a day of infection. Even then, gastrointestinal anthrax has a 50% or higher mortality rate, and inhalation anthrax has a mortality rate of close to 100%. What treatments, if any, can be given to a patient suffering from inhalation anthrax? Some antibiotics can be given, including an injection of anthem or anthracil, a sterile solution for infusion. Intravenous penicillin can be given with corticosteroids to reduce lung swelling as well. And since inhalation anthrax attacks the lungs, some cases may require the use of respirator to assist with breathing and fluid drainage of the lungs. What about other treatments for gastrointestinal anthrax? Well, the standard antibiotic treatment is a 60-day course of antibiotics. However, with advanced cases, antitoxin therapies may be used as well to target the toxins instead of the bacteria. What treatments are there for injection anthrax? For injection anthrax, the standard antibiotic treatment is given, and sometimes the infected tissue can be surgically removed. Researchers at Baylor College of Medicine continue to look at innovative ways to ensure the public's safety from anthrax and are currently looking at enzymes that allow for the resistance some strains of anthrax have to the antibiotic penicillin. As for the rest of us, our journey ends here. Thank you for watching, and make sure to always wash your hands and check any suspicious envelopes for traces of the great bioweapon anthrax. I'm your host, Sibel Zablakis, signing off.